Here's two women who have very similar experiences in their luteal phase. They both have rage, they both have depression, anxiety, overstimulation, disordered eating, they feel fatigued. They both meet symptom criteria for PMDD. So then why, when they both go to the same doctor, the same physician, is Susie given birth control and Amy given SSRIs? Because the diagnostic criteria of PMDD, as described in this diagnostic manual, tells your doctor what you're experiencing, but it doesn't tell your doctor why you're experiencing it. Because your medical treatment is determined by your symptoms, your medical history, your genetic predispositions, your doctor's clinical judgment. There's multiple factors that go into a reason why a doctor would choose one treatment plan over another. And I want to break these down with you. To be completely transparent with you and put all my biases up front in your face, I have taken many of these medical treatments and many of them did help with symptom reduction. However, over time, their effectiveness just wasn't felt and side effects were not something that I wanted to deal with. So I have since stopped all medical treatments over 3 years ago and put my PMDD in remission without being on medical treatment. But there's many, many women who tell me that these treatments have been life-changing for them, that these treatments have completely altered the way that they experience their life and have saved their life. And these proven treatments do have clinical support for women with horrible luteal phases or PMDD. The first treatment that is commonly offered to women with PMDD is a combined birth control pill like Yaz. And the way that birth control works, specifically this combined pill, is that it shuts down ovulation and therefore it shuts the cycle, the hormone fluctuations that may trigger a PMDD like response or a PMDD like experience in your luteal phase. As of today, I believe that Yaz is the only birth control pill that has FDA approval for PMDD treatment. However, your doctor may prescribe you some other combined pill or some other birth control. Many women also talk about being given a birth control treatment like Slind, whereas Slind has a similar mechanism in that it suppresses ovulation so that it doesn't cause that cascade of events that happen after ovulation that can trigger PMDD symptoms. However, it's not a combined pill. So those women who are very sensitive to a combined pill might see a better experience on Slind or on a pill like Slind. If a doctor prescribes an SSRI is completely different in function than a birth control pill. And an SSRI specifically for women with PMDD or a luteal phase dysfunction is used because of the way that serotonin shifts across the menstrual cycle. Because when you have shifts in hormone fluctuations, there is also an associated shift in neurotransmitters like serotonin, like dopamine. And that relationship in women with PMDD who may be more sensitive to their hormone fluctuations can cause these symptomatic expressions. For example, a lot of women, myself included, describe the couple of days before their period as triggering complete hopelessness and depression and feeling just completely unlike yourself. That can be associated with the drop off of hormones before your period that triggers the shedding of the uterine lining. And with that drop off of hormones can come that association and that drop off of those neurotransmitters. So using an SSRI can help to mitigate that. If a doctor prescribes something like an HRT, like a progesterone, this is very, very individualized. And this can be because their luteal phase response, their ovulatory response has some abnormalities in it. And therefore, this is one of the reasons why I tell women with PMDD that or those PMDD like symptoms, the very first thing that they should be doing to try to help to understand why they have these symptoms is to be confirming if they're actually ovulating. Because with those luteal phase abnormalities can come a weaker progesterone production. If you're not ovulating, you're not producing progesterone. Or if your ovulation is scientifically, this isn't the best way to describe it, but if your ovulation is weak, then you will have a weaker progesterone output or a possible insufficient progesterone output. Using a hormonal therapy like a progesterone, like a bioidentical progesterone, like Prometrium, which I hear a lot of women talking about, can help to mitigate that because they're helping to the progesterone response essentially. And so in my own life, what I have done is done things that naturally are supporting ovulation and that are naturally supporting progesterone production. And I'm also monitoring my hormones. So if I see that there's a continual decline in progesterone, that is when I may take my data to my doctor and say, hey, I'm noticing a downward trajectory. I'm getting older. Hormones are declining. Maybe it's time that I look into some HRT treatment, possibly, or do you have any other solution? Some other treatments that are available, but I don't necessarily hear these medical treatments talked about as much. And I think it's because of the nature of them, because usually you're trying many other medical methodologies, many other medical treatments before these, but they are available. Things like a GnRH agonist, which is like Lupron, something that's like a chemical menopause, which essentially shuts down ovarian function. It can be reversible. And so this is like temporarily putting you in menopause so you're not experiencing those fluctuations. Another very permanent solution, which is why I hear about this, but I hear about this usually after they've tried multiple things, as an oophorectomy or hysterectomy, removing the ovaries, removing the uterus, permanency, but you are stopping that cyclical nature of your cycle when you remove the ovaries. All of these medical treatments that we've discussed have clinical support, and these are some of the ones that I most commonly hear talked about. Of course, there's many other medical treatments. There's over-the-counter ones that we didn't discuss in this video, like antihistamines, which I've talked about in several other videos. There are many medical treatment options out there, and ultimately, it's your symptom presentation, your medical history, your preferences, your doctor's clinical preference, which treatment they will choose, your blood test, all of the things that are showing your doctor what treatment may be best for you or what treatment we want to try out first. Ultimately, though, all of these treatments are symptom management. And though they may be so beneficial in symptom reduction, that may be a clue for you to say, hey, X treatment is working. So then this may pinpoint me closer to what's actually causing this horrible experience in my luteal phase, to what's actually causing this horrible PMDD experience. And it may give you a better way to say, I can support my body while I'm using this medical